Hi everyone, welcome to another episode by Med and Ed. Today we have Srushti with us. So would you like to tell our viewers a little bit about yourself?
Hi, Malika. My name is Dr. Srushti Sahukar. I'm a doctor, like I said already. And I'm also the founder of medbytes.nom. It is a medical education page that I mostly run on Instagram. It's also there on Facebook, but I'm not that active on Facebook from medbytes. And like you requested, I thought I'll come on air and speak about the elective experiences.
So thank you so much for taking time out of your busy schedule to talk with us today. So basically what is an elective?
So an elective can is an away rotation that you do at a hospital that you don't already work at. It is about broadening both your professional network and gaining a new experience, and also, like, learning how other systems work outside of what you've already seen. So there are two types of electives actually. There you can do a clerkship or you can do an observership, but both electives are equally valuable because you get to learn a lot. They say that clerkships are better because you get more hands-on experience, but it really depends on what's available at the time.
And how does one get an elective?
So electives are mostly for students in third, fourth, and internship year of medical school. These are actually hosted at hospitals in the United States that are tied with the medical school of that university. And you can there are four main portals of how you can apply to these electives. First one is, if your med school, the one that you're enrolled at, if it participates with what is called the VSAS program, which stands for Visiting Student Application Services. This is a program that has been started by American Association of Medical Colleges that uh, allows students to connect with and obtain rotations, like in the United States. Whoever is interested, they can do like even exchange rotations, or they can just go do rotations. So you just have to become a member, like get in touch with your school coordinator, become a member, apply with all the prerequisites for the application, and you can go do your rotation and come back. There are also many agencies that provide this kind of service, as in like connecting interested students to hospitals or clinics who are willing to accept students to under them to do shadowing and stuff like that. So the popular ones that I've heard of are AMO opportunities, med clerkships, and Ameri clerkships. But I'm sure there are many other agencies like this. These are the ones that I've come across, and I've personally used AMO opportunities twice, and I really liked them. They're very reliable. The third one is you can individually, like, suppose, let's say that your college doesn't participate with visas. You can go to the individual university web pages and apply. Just follow the instructions on their web page and you can apply through that. Or you can just network through contacts, or you can just send out cold emails to doctors and see if you get lucky. Some of my friends have done that as well, and it also works.
So thank you, Dr. Srushti. Dr. Srushti, I'm sorry. And so what are the requirements to apply to an elective? Like what sort of prerequisites do you need to be eligible to apply for one?
Okay, so like I told you, this is for international medical graduates, and actually, even in United States, like one student from one medical school can do a clerkship at an other program. It does happen, but I'm talking mainly for IMGs because I am an IMG and I'm not an AMG, which stands for, so AMG is American Medical Graduate and IMG is International Medical Graduate. So when it comes to requirements, you need to show them proof of being enrolled in a medical school. So that can include various things like dean's letter, a bona fide student certificate, a marks card, or, like, there are like many proofs of enrollment that you can show to the, like it has to be a part of your application package. And the resume especially is important because this is based on which they will either offer you the elective or reject offer you the elective, or they might reject you. Because resumes are important as it is quite competitive to get these electives. So your resume can include anything and everything from what you've done, like co and extracurricular activities in school, any volunteering that you've done, research, your test scores, all of these things come under the resume. And then again, there's the proof of enrollment that has to come from your, with the letterhead of your medical school.
So do you have any advice on how to build your resume to sort of apply to these electives?
I wouldn't say that you should be keeping the ultimate goal as applying for electives. It's more about how you want to build your professional resume in general. While that can be a separate discussion of itself, I would say just go put yourself out there. Because if I can speak from my own personal experience, I did a lot of volunteering in second year of medical school because it's a longer year compared to the others. Instead of um, 10 to 12 months, we got 14 months to prepare for the exams. So I spent a lot of time campaigning, and we did like a breast cancer awareness month. We did AIDS awareness. We went to local schools and taught them hand hygiene, like how to wash your hands, because bad hand hygiene and bad hygiene in general and fomites are one of the biggest causes for transmitting infections. And if we can teach them to do that at a young age, they can go on to be healthy, happy people in life. So I did all of that. And then I started my own YouTube channel for medical education, and I have the MedBites, which is my main medical education platform. So it's really about see, because for me, my passion is medical education, but there are other friends of mine who are really into research, who have published 3 4 papers already. So it really depends on what you want to do, as your contribution to um, the medical field, and that ends up adding to your resume. And this is everything that you're going to put forward in your resume when you even apply for electives.
That's so cool, and that all the volunteering work you do, that's really interesting.
Thank you.
And what, like, other than proof of enrollment, what other additional, like, sort of documentation is required for applying?
So some schools ask for dean's letter, some schools ask for, dean's letter of recommendation, and some schools might ask for just a letter of recommendation. It can come from any doctor. So it really depends. But then I think marks card and bona fide student certificate would be standard. Yeah. Do you want me to talk about the additional requirements now, Malika?
Yeah,
Okay. So there are also some additional criteria that some of the programs look for. Sometimes they might ask for the step one score. Step one stands for this first step of the USMLE, which is a series of 3 examinations that everyone who wants to practice medicine in the United States have to appear for and clear. So sometimes they might ask for the first step score. They might ask you for a BLS and ACLS certificate to make sure that you know how to do a proper CPR if ever there is a sudden arrest of a patient. And then they can ask for TOEFL test scores as your proof of English proficiency, because these are important for them. Sometimes they will even run a background check. So this depends, because twice I was asked to run my own background check and send them the proof of being cleared. And on 2 other occasions, they themselves ran the background check on me after I was accepted into the elective and I paid the tuition and everything.
and what would you say is the timeline for applying? Like, when should you start to apply, and when will you get the result that you've been accepted or not?
Okay, so for this, Malika, I want you to pull up the portals of entry once again
Yeah,
because it
I
really
just
depends on how you're applying to the elective.
um,
Okay, so when it comes to visas and AAMC, usually they ask you to apply within 90 days of starting the start of the elective, which is like 3 months. With AMO opportunities, it's super quick. You could apply this month and be gone next month for the elective. With agencies, it's always faster because you're paying them a commission for connecting you guys along with the tuition that you pay to the doctor or the program itself. If you're applying through individual web pages, this is the one that takes the maximum amount of time. They want you to send in the application at least 6 months in advance. Okay, and some of them even ask you to send it like 9 months in advance, and especially um, electives which work on a first come first serve basis, they're very competitive. So when I actually applied to Mount Sinai Hospital in New York, and I had gotten accepted, but I didn't end up going there because the pandemic started by that time. But then for that particular elective, I had applied like 9 to 10 months ahead of time, just to make sure that I don't miss out on the elective. So it really depends on like what they even, but 4 to 6 months in advance is minimum.
and
With the cold emails, again, it really depends on what relationship you have with the clinician who's taking you under their wing.
once you do get accepted, what sort of additional insurances do you need, or like what? Oh, sorry, please
Yes,
continue.
actually, malpractice insurance, usually they ask you to procure it after getting accepted, but even before getting accepted, as a part of your application package along with the dean's letter and everything, you have to can you pull up the serologies,
One second.
the hepatitis and the
I don't. I don't think I made. Um.
oh, it's all right, I can open it on mine. uh, I'll just open it on my WhatsApp. Wait. So,
I don't actually think we made a
can you
checklist for
see
that.
this, or am I supposed to share the screen with you?
I think you're supposed to share the screen. There's like a green button, sort of.
Okay, so this share screen. Okay, you have disabled participant screen
Oh.
sharing, so just
Um.
enable it.
Yeah. Can you share it now? I'll just see.
Ha, I'm able to. Ha. So share. So you can see that. So whenever there is an application package, right? For example, when I applied to Mount Sinai Hospital, that is tied with ICANN School of Medicine in New York City, they had a immunization form which the doctor had to fill out and attest, right? And along with that, they might ask you for lab reports of immunity against hepatitis B, measles, mumps, rubella, varicella, and tuberculosis. And they might also ask for proof of being vaccinated against Neisseria meningitidis. So these are all highly infectious diseases, and because many of us are from third world countries, and like tuberculosis is not even a big disease in the United States. They have eradicated it from their country, so they need to make sure that because we're in a hospital setting, we don't accidentally
Yeah.
infect somebody and cause an epidemic over there. So they need to know that we're immunized against all of these pathogens, and sometimes the list is going to be longer, but these are definitely the standard ones.
Okay. And are there this are any other sort of things required that documentation after you get accepted, but before you go?
Can you repeat that question, Malika?
I meant like, are there any other documentations required, such as insurances and stuff?
Yes, you do have to show them a malpractice insurance. You need to purchase a malpractice insurance actually. So I used. Can you share the ones with the insurances?
Yeah, just
So I use the first one, which is academic medical professionals insurance. These are the others which are offered, which I personally haven't used, but I actually found this list on an article that a friend of mine wrote on a blog site called Indian Medical Student. The link of which we can share it with the
yeah.
viewers of our interview later on. But this is required because. In case you mess up when taking care of a patient and the patient sues you or the doctor, if you're insured, then the insurance company will pay for the damages. If you're not insured, you would have to pay out of pocket, which is literally going to cost you an arm and a limb. So this is very important. Every elective is going to ask for a malpractice insurance.
Okay. And so, am I visible?
Yes, yes, you are.
Okay. And what are the things to think about when you're choosing, like in the elective? What are the factors you should consider when you're applying for one?
Okay, so it really depends on your goals. So for me, I wanted to do one advanced elective and one primary care elective. I did the one which I did, like the primary care one. I took history, did physical examination, and discussed every case with the doctor, and I entered the patient notes. And then I also did an hemato-oncology elective at Yale University, Yale School of Medicine in Yale New Haven Hospital, and that was really advanced in the sense that I saw sickle cell anemia, patients who came in with acute chest syndrome, which is a complication of sickle cell anemia. And I even saw disorders of blood coagulation, wherein there was sometimes the coagulation factors, right, in your blood.
Yeah.
There are factors 1, 2, 3, 4, 5 up till 12. So there was this one patient who had an anticoagulant antibody, and sometimes because we've studied about hemophilia wherein there is a deficiency of the production of the clotting factor
Yeah.
itself, but sometimes there's even an antibody that keeps the coagulation factors from working, which I thought was very interesting to see. And then I even did a PMNR elective at Spalding in Boston. That is the rehab hospital that is tied with Harvard Medical School. And I saw some really amazing cases. Like I saw transverse myelitis, I saw anti-NMDA encephalitis. These are all really rare cases. And to have worked on these cases and managed these patients, it's really mind blowing to me, because these are the kind of things that we hear about when we watch House MD,
Okay.
and we think, okay, oh, this is like really high level stuff. But then I actually saw some of these patients and I was like, that's really cool and amazing. And even at Yale, for that matter, they were running tests on patients. Which they had invented at Yale itself after rigorous research. And these were tests which I hadn't even heard of before, because everybody knows renal panel, a liver panel, and complete blood count. But they were running tests which I hadn't even heard of before. So I thought that was really interesting and definitely very aspirational. It would be an honor to go join a group of highly qualified doctors for my profession later on. It was very inspiring to me.
All of that is so interesting and honestly just so inspiring. Just listening to that makes you like want to like apply to this.
Everybody should take, whether or not you want to eventually move to the United States. This is, let's not even make this about residency, this is about learning and growing, because broadening your horizons is always a good idea, whether or not you end up taking up residency in the US. right? The intention behind doing these electives should be for learning. And if you're doing it for anything other than learning, it's going to reflect on the letters they write
Yeah.
for you anyway, right? Because you can't go through life like that, just thinking about resume and application and this and that. It really has to be about how this month is going to add to who I am, right? And even I did like an orthopedic surgery elective that was actually based on convenience, because that was being offered in the same locality where my sister was staying. And I, for the first time, I saw intra-articular hyaluronan injections and intra-articular steroid injections that the doctor was administering for patients with osteoarthritis. I had never seen that being done, because when we talk about managing osteoarthritis in India, I've only ever seen doctors prescribing painkillers. So this was really interesting for me to have seen how far you can take it when you really invest into healthcare.
And that's so true. Honestly, I think that if you go and do an elective for anything other than learning, that's going to reflect in some way or the other. And what are the
Yes.
additional factors you considered while choosing an elective?
um I think it was more about even the geography,
Yeah.
um, because I wanted to do electives on the East Coast, because I really like New England. And then for me, Yale was really a dream, because I didn't even expect that I would get accepted. I had applied and I had just forgotten about it, because I was like, there's a chance I might not get approved for that elective. And I was working in the casualty when I heard back from them saying that I was accepted, and I literally started crying, and
Wow.
everybody was staring at me. The things that you want to think about is like local culture, like for me, like going to Yale, touring their campus, that was really special. And you should also plan ahead for your accommodation, your food and commute. And definitely also remember that they value punctuality and sincerity more than anything else. You could be at the bottom of your class not getting very good grades, but if they see that you're committed to what you're doing, and that you're working hard and doing the best that you can, right? Because there are so many of us who are capable of so many things, that but we still keep half-assing it, right? That's not appreciated. So being very punctual and sincere is very important when you're on the elective. Ahead of time, you would have to look for good accommodation, and make sure that your commute is no longer than 15 to 20 minutes, so that you don't spend your energy commuting, and you can actually put that energy into researching whatever you learned in the hospital. You can go on up to date, read up about it, make notes about it, use that, feed them into your flashcards, and use that to really connect to the topics that you read on your textbooks. And food is usually usually they'll be having cafeterias, or if you're into meal prep, you can prep it, box it, take it, because nobody there's not an actual lunch break officially in the United States. They all do like a quick brunch at noon. And if they're ever hungry in between work, they'll just grab a bite or two. There's no, like, the way it's in India, like breakfast, lunch, dinner, there's no that kind of culture really. And the main meal for them happens to be dinner actually. So just the focus is on work, on not on anything else but work.
Yeah,
Yeah, that's
thank
what I
you.
would
Those
like
are
to
really
say.
important factors to think about.
One more thing I want to add, Malika, is about making not just professional network with older doctors who can write letters for you. It's also about building connections with your peers. Because when I did my elective at Yale, I met so many students who came from China, India, Pakistan and Malaysia, and some of them were even from South America, like Colombia and Brazil and everything. And I made friends with these people, and I'm still in touch with them, and one of them has actually become one of my best friends who I tell everything. And we've really helped each other come out, and one of them actually really supports me with the whole MedBites page. So it's really about building everything. And if you're moving to the United States, it might actually end up becoming the foundation for your life in the US.
Yeah, that's so true. And do you have any sort of popular electives that people apply to or they should?
I do. Actually, these are the ones in my experience which most of my peers have applied to. The first one is Harvard. Then there's Stanford, Yale, University of Chicago, Mount Sinai Hospital at Icahn School of Medicine, Florida International University, Columbia, and Keck School of Medicine and University of Southern California. So these are just a few of many. There are many. There are at least 50 to 100 programs that accept international medical graduates to come do electives at their hospital. So it's really about staying aware, speaking to your seniors, and doing a lot of googling. Just a lot of googling. This is how you get to know where what is and what all you need to do, prep ahead to get these electives done.
Okay, so that's really cool. And how was your whole experience with the application process?
The application process honestly is quite stressful, because there's a lot of proof that you need to really sell yourself. And it's the same thing even with when applying to residency. You really have to sell yourself, right? So that happens even with the electives. So the application process was definitely quite stressful because I was running around getting my blood tested, getting the reports, filing everything. Some of them it's easier because they ask you to upload everything to their web page, and that's the application. But Harvard especially wants physical documents. They want, like, copies of everything to be mailed to their office in Boston. So it was just a lot of running around. It was quite stressful, but I did everything very meticulously, and it really paid off.
So, how was your experience at the electives, during the electives?
So what I noticed, Malika, is that, so one of the doctors that I worked with, actually all of the doctors were amazing, but I'm going to talk about one particular doctor that I worked with at Yale. This is mind blowing. He did his undergrad at Stanford. He did his med school at Yale. He did both his residency and fellowship again at Harvard with Massachusetts General Hospital and Dana-Farber Hospital, where he did his hemonc, and then he's back at Yale University doing he's a professor at Yale University, teaching hemonc and treating patients with cancer. And he has done just so many things with his life. He has published articles in the highest impact journals. But I think the one thing that struck me the hardest is how humble all of these people are. They don't show off. They don't act like, oh, I'm so high and mighty because I've done so many amazing things with my life. He treated me with so much respect, and um, it's the kind of respect I never got. Not even, I mean, I'm again not dissing India or anything like that, but no one has ever treated me with that much respect, at least someone who's that much older and that much more experienced than me. And I felt like the way he treated me, I felt like I really mattered, that he was paying attention to me and he wanted me to learn and he wanted me to succeed. And there was just this amazing rapport. Um, and I felt that with quite a few doctors that I worked under. Um, Even at Harvard, there were two PMNR doctors. PMNR stands for Physical Medicine and Rehabilitation. So even they were so welcoming and so chatty, and they never made me feel like uh, that I was from India and I didn't know anything. They treated me with a lot of respect, and they wanted to know how it is in India. and they wanted my perspective on things as well. So it was really amazing. I think the thing that struck me the most is how kind, humble, and hardworking everybody is, no matter what their professional status is.
That's so inspiring to hear, and that's honestly just an amazing experience. So that's pretty
Yes,
much all of the questions we have for today. Thank you so much, Dr. Srushti. Like, this will help a lot of people, and I've
I
learned
hope
so
so.
much. I'm sure that everyone will learn so much from this. Thank you so much for doing this.
Thank you so much for inviting me. It has been a pleasure to talk about this. I really want more and more people to gain good experiences and widen their professional horizons. Thank you for choosing me to be here, and have a wonderful day.
Thank you. Have a great day.